So the first thing that came to my mind is that we're physicians and we have the ability to do telemedicine and see our patients and have video conferencing and everything. But I do think that there are lots of people who have lost their jobs, and how are they coping with that?
Yeah, so I do get a lot of calls. I have connected with a lot of patients, who are saying, Dr. Worry, this is my last day of insurance. I'm losing my job next month, next week. And it's, like I said, it has taken its toll, like economy-wise, like people are losing their job. And it's tough, something that I guess we can't really control right now because of the extent of this pandemic. And I'm just hoping, that they're able to find jobs in other areas, that can open up and we can get the economy back going. But right now, it's such a tough situation that a lot of people are going through. Yes, we are lucky, some of us are lucky that we are in that profession where we have more stability and more safety. But yes, a lot of people, and I can understand like why they're getting more anxious, and but it's just hoping it's temporary, like I said, they can come back in another profession. Maybe they can go and learn some skills, maybe they can get some certification, so maybe they can find other ways to
Sure.
do something different and come back to the workforce.
Yes, I think this would be an excellent time for somebody to take the advantage of the computers and do a lot of online courses if they needed to do to improve their resume and make things a lot better for them. I do agree. I actually forgot to introduce myself. I am an endocrinologist in the San Jose area. And basically what I do is I treat diabetes and hormone problems. Um, and so I have actually noticed that a lot of kids who have been spending a lot of screen time, I do get a lot of older kids who are like 18, 19, 20, who have actually resorted to drinking alcohol. They've resorted to going back to their old habits, a lot of, because they're all stuck at home and all this screen time and not necessarily getting out and exercising. And obesity has become a factor. So is that something that you've encountered? Have you kind of?
Well, I mean, in general, like when you see there are a lot of other problems have cropped up, like domestic violence, that's one of the major one because of it's probably with lockdown, the resources are not there for a lot of people to reach out and get help. And then again, with more alcohol intake, more substance abuse because of the stress. So I think it's causing a lot of psychological, behavioral changes around.
Mhm.
And again, different age groups are having their own problems in terms of coping with the lockdown. With in terms of teenagers, yes, I can see that they want to go out and they want to resume, especially the weather is getting better here in West Coast. So, but we still have to, again, talking to them, making them look into, read some data, say, this is something, that we have, this is the only choice we have right now is social distancing. And, this is something that we all have to do. I mean, they can do a lot of social media in terms of social networking. Like I said, I do let my kids, like they're 14, I mean, they're not 18, 19, but still, they understand that where I'm coming from, because I give them their space to do what they want to do. But I also set some rules that, what, we have to do this. And, it's having that word, having that dialogue with your kids that, we are not just your parents, we're also your friends right now. With the lockdown, you're stuck with us basically. So I think it's just communication is the key part in terms of how we, and again, Zoom session, family session, a family night, family game night, board games. I mean, they all need to come back, right? Because that's what we used to do back in India growing up, right? Playing in the house, playing, board games. So, and again, going out for a walk is not a problem as long as you're masked up and you have safe distance. So you can still encourage some physical activity as long as it's done within the the guidelines. So there could be a lot of different things, different aspects.
Yes, I do agree with that. I'd like everyone to put in their questions as we go along so we could take them a little later or even right now if you had something burning that you would like to ask. Since I don't really see anything as of yet, I did have another thought that comes to mind. I actually live with my mother-in-law, and I've noticed that she has been spending a lot of time on the sofa. And she used to go to ICC and spend a lot of time with other older folks doing yoga and etc. And that has actually not been there at all. And she's pretty much been in the house for the whole time, which I think has made it very difficult in some ways. I mean, she has been entertaining herself with TV and the usual, and cooking and stuff like that, and helping me out immensely, which I have been very grateful for. But I think that they need to have some other outlet. And what do you do in this time frame when you don't have anything going on?
Right. I mean, it's like a double-edged sword, right? I mean, it's a blessing that they're here in the house, to kind of help us because we are working from home too.
True.
So, but in terms of like, yes, they're missing that that connectivity, that connection, and how do we kind of, make them change the way they connect now, because like I said, it's going to be a long term, like 6 months to 1 year, and so it's something, that they need to maybe join Zoom sessions. A lot of senior people are joining Zoom session, whether it's like some other activities, so they are doing a lot of Zoom session. And we do need to encourage activity because I do see a lot of weight change, like you mentioned, obesity, and then blood sugars. Diabetes is actually, some patients are saying, because of the activity, it has caused increase in the blood sugars too. So it's affecting our seniors a lot more, because when they're not active, they lose their muscle mass faster, and they kind of get weaker. So when I talk to my senior patients, I encourage them, you have to do some sort of chair exercise, chair yoga. You can still be active. You can still be inside the house and you can still be active. So I just kind of give them some resources that, you go out, but you can still maintain your gardening. Right now, the weather is getting better, so be out, do some gardening. But don't forget to do your shoulder, your exercises, because you need to maintain your muscle strength and muscle weight.
I'm not seeing any other questions popping up. So how do you go about your day? How do you manage to keep yourself and your sanity and everything in all of this? I mean, I'm a women physician and I have a child at home, and sometimes I just find it difficult to, go about my day and not lose my temper somewhere.
No, and this is okay to do that. Women are supposed to, show all emotions, so it's okay if you lose it, once in a while. But here's the thing, for me, I think I do need to have some time to myself. I think everyone deserves some time to themselves. So after I'm done with my schedule, take care of the meals, I do have a dedicated Zoom exercise session, 1 hour, 1.5 hours a day, every day. And I started doing that a week or 10 days ago. And I found that immensely helped me with dealing with my own anxiety, because I actually went into some sort of a mild depression because I was not working for 10 days. We took vacation. And I had nothing to do. I had like lost purpose. And then I was like, I'm not doing any patient care. I'm not talking to anyone. I'm just home cleaning, cooking. So this is not what, for me, life is, all about, So I needed more challenge. I was missing that challenge. I was missing that purpose. So once I got back to work, finally, I had the best first day back to work. I had 7 video visits with my older patients. And I was just like totally like day and night when I started work. And then exercise. I'm a huge believer of what it does to your body, like emotionally, more, physically, yes, but what it does to you emotionally, I think that's my life savior. So, and again, your social connect, your network. As you know, we have a huge WhatsApp group of our, Desi doctors.
Yeah, I'm very well aware.
So I think that is my to go to. And, we have such a great network, like whenever somebody's down, we just know somebody's down and we go reach out. So, having your social core connections that you can reach out to if you need any help. And it's okay to ask for help, because you can't be resilient all the time. You can't be strong all the time. And it's okay to drop the ball sometimes. You don't have
sometimes
to be.
I think people wonder what we would do without the WhatsApp and all the other social media. Imagine if we had this problem like 20 years ago. We probably would have really had an issue.
Yes, yes. I think it's a blessing, the social networking, because you maintain those bonds, which you need, so.
We have someone else with a question that says, what are the top three issues faced by grandmothers during the lockdown, and the specific action items you would recommend to them to deal with those issues?
So top 3. So again, like, Manju, she gave really good idea about her routine. So I think, if we can have, Manju's routine, it's going to help a lot of people. So staying active in terms of socially active, in terms of the top top three would be depending on the education level, whether how comfortable they are using technology. I think that would be one factor in terms of how comfortable they are using the technology, computer, laptop, or their smartphones. So that could be one factor. The other thing is, obviously they're not seeing their family in person as much. Or maybe there's some families, they can't travel back because there are a lot of families who are here. They're supposed to go back to India, or they are in India, they're supposed to come back. So I think there's a lot of traveling chaos also. So definitely, the distancing has made a lot of our seniors depressed because they just can't hug their kids, their grandkids. So I mean, it kind of varies, like, where you are. It varies with your educational background. And, I think between those two would be the most top two I think factors in deciding, like, how our seniors are able to face or come out of it, and, what kind of help they have, whether they have a good support at home. So, it just depends on from like person to person, like different factors affecting their quality of life, how it has changed now.
So we have a physician question and comment. As physicians, burnout is already high. How can we live with moral distress and the guilt of deep sense of duty versus the risk to my family? Any suggestions on strategies of how to create the balance and feel a sense of purpose?
Yeah, that's a whole 1 hour talk, honestly speaking. We'll be here forever talking about it. But yes, we do see a lot of distress. We do see there's going to be a lot of post-traumatic stress disorder in our healthcare givers, because inability to provide the care that we want to, the expectations set on us, moral injury, ethical injury. I mean, we have to go through so much of emotional trauma because we are trained to treat the disease, but what we were not trained to is to see all this emotional conflict that we're going through. I don't feel safe. I fear for my family. I mean, we have, like, today's Mother's Day. There's so many mothers that are not able to hug their kids because they're working with COVID patients. So that's taking a toll, right? So things like this, it will add up. And I just hope, we have good resources for our healthcare providers to give them like a helpline to get them out of it. But we need help. We need more help. We need more resources. And it's not going to be like, once COVID is over, we're going to be fine, normal, everything is going to go away. No, this is going to have a long term. We already have a burnout rate of 50% in physician. And especially in female physician, the burnout rate is higher. So this is obviously going to increase our burnout rate. So how well equipped are we? I mean, as organization Kaiser, yes, we have tools and resources. What about our physicians who are doing private practice? So it depends, like, who has what resources. So it is going to take its toll. And so that's another repercussion, like, we kind of, are so guarded, and so, it's going to happen. But stay strong. Like I said, we need to support each other. We need to stay positive, reach out, talk, pick up a phone, and just do whatever you can in your capacity, whether you're physician or non-physician. Just reach out and, just talk about it. Just talk about it and see what you can do about it. And what you can't control, you just can't control. But do your best and, try to stay positive and take care of yourself as much as possible.
Thank you, Jasdeep.